Thank you for coming today to our Caregiver Planning for Your Future Caregiving series. Very happy that you're all here. And I would like to introduce Corey Ramirez, and she'll tell you what she does, and she is going to be our speaker for today. Corey?
Hello, everybody. I'm Corey, and I work with Adventist Health, Home Health Hospice Services. Can you hear me okay?
Yes, yes.
Great.
Perfect.
I'm so happy to be here with you and talk to you about caregiving options. I'm going to go ahead and share my screen so you can see my presentation. This one. Okay, just let me know if there's any problems with the visual.
It's perfect.
Corey, can you please open up the chat, because that's where our members will be putting questions in. Is it possible you can open your chat?
But she doesn't need it till the end.
Right, but it needs to be open for her to see the messages.
Mhm.
So it's okay, we'll read the questions if you don't have them, no problem.
I do not, oh, here's chat. But let's
If
see.
it's a problem, Corey, it's okay. We'll just read the questions to you.
It's visible in the middle of my screen though, right?
Right, so
Yeah,
just
go ahead and close it then.
yeah,
Yeah.
close it and we'll work on that later. Okay.
Okay, so does this, everybody could see that then, right, Melissa?
Yes. Mhm.
Lovely. So when is a caregiver right for you? We've all heard of all the different options for caregiving for yourselves or for loved ones. So I just wanted to talk a little bit today about what some of those different options are. So some signs that you or a loved one might be in need of a caregiver are when a loved one starts needing more help with activities of daily living. It's probably a term you've heard a lot, from bathing to using the restroom, any of those activities, getting dressed, things that we do around the house, sometimes get more and more difficult. So that's one sign that we might be needing some additional assistance. When we're needing transportation to and from our activities, which thankfully we're starting to be able to have some activities outside of the house these days. And also doctor's appointments, medical appointments. So there's different things that we would need to get out of the house for, and that certainly does get more and more difficult. That's one sign that a caregiver might be helpful when we can no longer provide our own transportation. Another sign is when we start needing help with the cooking, cleaning, and household responsibilities. Now, I'm just going to say right here that I already need help with that. So I'm looking for a caregiver if anybody can think of a good one. I'm just joking. No, really, I need help with cooking. So there's that. And then sometimes we just need somebody around the house, especially this past year. We've all experienced that being alone in the house can be very difficult. And having that extra person helping with activities and being somebody to just talk about the day with is very important to all of our well-being. So here we're going to start talking about the different types of care. So there's in-home caregivers, also known as, referred to as maybe a private duty caregiver. So this is going to be somebody who offers non-clinical help. This is going to be meal prep, companionship, transportation, assistance with those activities of daily living, light housework. It's important to recognize that this is something that is not covered by health insurance. This type of assistance would not be covered through Medicare or Medi-Cal. This type of assistance being paid for privately would be something you could use in addition to home health, hospice, or in-home support services, abbreviated here as IHSS. So because it is paid for privately, it does not impact your ability to receive all those other services which do go through insurance. So home health is different from an in-home caregiver or different from the private duty caregiver because this is clinical help. So home health services, such as what are provided by Adventist Health Home Health, is a clinical medical supervision provided by a licensed professional. So the staff that would be seeing you through home health would be like a nurse, either a registered nurse or an LVN, a physical therapist, occupational therapist, speech therapist, social worker, people who are clinical staff. They would come in and offer intermittent care. It's not continuous. So one big difference from the private duty or in-home caregiver is this person would come in, provide their services. It usually takes 40 minutes to an hour. And then they would leave. So they're not providing that companionship or light housework or meal prep. That's not their role. This type of care is prescribed by a physician and it is covered by insurance. The abbreviations, I'm sorry, I should have written those out. Registered nurse, PT for physical therapist, OT for occupational therapist, ST for speech therapist. They can do things, the responsibilities they would be able to provide can include, but are not limited to, administration of prescription medication, monitoring of health status, such as checking blood sugars, blood pressures, weight for heart failure. They'll do wound care of all varieties, changing all types of dressings. They'll provide IV medication administration. All of these services would be through a nurse through the home health service. This can be utilized in conjunction with the in-home caregivers and IHSS. We frequently hear people say they can't have home health because they already have a caregiver. That is not correct. You can be paying for a caregiver and receive home health services at the same time. It gives that extra support in either direction. And the in-home support services can be in addition to that as well. Let's see if I can get to my next slide. Try and move a little faster here. So hospice offers special services to improve the quality of life of terminally ill persons by controlling the symptoms of the illness and restoring dignity for the person until death. This is a team of professionals working collaboratively with the patient and family to meet physical, psychological, social, and spiritual needs. It does provide medical and nursing care, social services, dietary consultation, counseling, and emotional support for both the patient and the caregiver. That's important to note. This is a service that provides support to the patient and the caregiver. All equipment is included with hospice service. So if the person on hospice needs a bed, wheelchair, incontinence supplies, other types of supplies, oxygen, it's all included through hospice. It's most effective when it's initiated sooner in the disease process rather than later. This support is best utilized earlier on in the situation versus waiting for the last couple weeks. It provides so much, you don't want to miss out on all of that. So the big point here, though, is this cannot be utilized. So this can be utilized in addition to caregivers and IHSS, but not in addition to home health. So it's either hospice or home health. You don't have those at the same time, but you can still be having your caregiver or IHSS services at the same time. So in-home support services are a benefit provided through all versions of Medi-Cal. So if the person needing support is a beneficiary of Medi-Cal, this is a service you can apply for online. It will pay for services provided to you that will keep you safely in your own home. Qualifying would be that the person be 65 years or older, disabled or blind. It is considered an alternative to going to a nursing home or a board and care facility, which are of course also paid for through Medi-Cal, or some part of them are paid through Medi-Cal. So this is an alternative to that in an effort to keep people living in their own homes longer. So this would, the types of services that can be provided through this are house cleaning, meal prep, laundry, grocery shopping, personal care services, incontinence care, bathing, grooming, accompaniment to medical appointments, and protective supervision. So this is something that the state can either pay a employed person to come to your house and help you with these areas. The application process, the state would determine how many hours per week the patient would qualify for. And it can also be something that then would be paid to a family member. Let me just check really quick if there was there is a second slide for this. So this is who it's for, the eligibility requirements. But the part that I find the most interesting is that if you have a family member that's providing services for you, you may benefit from that family member receiving payment for their services. But if you don't have a family member that is able to provide help, then the state can pay somebody else to provide the help. So it does depend. It does require you to go through the application process, and then the state would have a social worker do a visit and determine how many hours the patient would be eligible for on a weekly basis. So this can be used in addition to, if you're paying for a caregiver, this can be in addition to that caregiver. Maybe if you only need a few hours a week of meal prep or light housekeeping, maybe this could be instead of the paying for the caregiver. But this can also be in addition to home health or hospice. So if you're receiving a nurse through home health to help you with your medication, you can also apply through the state for the in-home support services to have that caregiver with you for those few hours a week. That's another one where people think if they have in-home support services, they can't have the nurse through home health. So they complement each other. They're not exclusive. So back to caregiving specifically. So this is referring to if you're having an in-home caregiver that you're paying for privately. Typically, the companies are going to require at least 4-hour minimum on a weekly basis. So you can't have them come like just for a half hour, help me get dressed and then leave kind of thing. You would have to schedule out for minimum blocks of time, and they would be paid for on an hourly basis. You pay the agency for how many hours you would need this caregiver. And the rate in Los Angeles, the average rate is between $25 and $28 an hour. Every agency is going to be slightly different. So what do you look for when you're looking for this caregiver? I picked this picture because it made me think of taking this giant leap and needing the extra support to have this caregiver come. So here are some ideas of what you're looking for in your caregiver. You absolutely have a right to expect certain things. And if you're not getting having your expectations met, then you absolutely have a right to look for another caregiver. This is something you're paying for. Do not accept anything less. You need somebody who's going to be patient. We all know that we have our difficult times when we're not communicating our needs well. Well, our loved ones who need the additional help are going to have the same situation and have difficult time expressing themselves. And so you need a caregiver who's going to be extra patient, somebody who's compassionate, understanding of what the person is, what your loved one is going through. Having a need for a caregiver is a difficult thing. And the person who's providing that service needs to be understanding of that. You also want somebody who's going to be attentive. They didn't come to your loved one's house to watch their TV. You want somebody who's going to be paying attention to your loved one. It's very important that they understand that they're there to provide physical needs and emotional support, and need to be looking out for just whatever it is your loved one needs. You want somebody who's dependable. You're looking for somebody who's going to show up when they say they're going to show up. You deserve nothing less than dependable services. You are looking for somebody to come into your house, with all your personal belongings and learn about you and your family. You want somebody you can trust, because that person is going to, have a very intimate relationship with what's going on inside the house. And you just need a comfort level. Those receiving care need to match personalities to achieve comfort. Not everybody gets along with everybody, and that's okay. You don't need to accept a caregiver who doesn't provide that match. There's nothing wrong with going back to the agency you're working with and saying, hey, look, for whatever reason, this person isn't meeting our needs, and you want to try a new caregiver. It is not uncommon for the family making the arrangements for the caregiver to ask, you hold interviews, and you can always change as you go. There's no obligation to stick with the person you picked or to pick the people you interview. So definitely some things you're not going to want to accept are somebody who refuses references or a background check. That is a red flag that this person may not have a good, may have things they're hiding. Also, you don't want somebody who's been going from state to state. They may be able to explain, such as this example of a spouse in the military, but without a very solid explanation. Somebody who has been traveling from state to state to state may have a reason for that, and you may not want to, you may not be able to trust that person. So definitely family members that have hired a caregiver, you want to look out for any unexplained bruises, infections, or illnesses in your loved one. Again, back to, this is a service you're paying for. You don't need to accept anything less than the best. So if there's unexplained situations, you don't have to put up with that. And frankly, you need to look out for them. And just like with our children, if they seem afraid, well, also with our seniors, we want to keep an eye on if the senior, if your loved one is just not telling you something, but you feel like they aren't telling you something, that's a red flag also. You don't want your loved one to be abused or neglected, and sometimes just not just this feeling that they're not telling you something is that sign. The caregiver could be saying things to them when they're not around, when you're not around, that are intimidating your loved one. There are so many great caregivers out there. You wouldn't want to settle for anything less than that. So you want to make sure that the caregiver is fully attentive and not ignoring your loved one, making sure that, you know, all of their needs are met. That person didn't come there to play on their phone. They need to be paying attention to your loved one. So this is a big one. They work solo. There are a lot of caregivers out there that are not working through an agency, and they will be less expensive than the caregivers that are working through an agency. But there's so much you miss out on by going through a solo caregiver. You want to make sure that you have a reputable agency that is checking credentials, providing education, and providing liability insurance. These are things you're not going to get working with somebody who is not working with an agency. So it's it can be very difficult to find somebody working by themselves that is going to be able to offer all of the things you're going to get from working with an agency. So another something to look out for is a friend or family member. They always say don't do business with family. It just depends on the situation. We all know this. Some of our family members are great, but especially when there's a money exchange involved, informally hiring someone to provide care may bring up situations that are hard to get out of. That person may also not be trained or covered through insurance in the same way that going through an agency would be covered. There are definite benefits to having somebody who is educated for this service, trained, certified, licensed, bonded, and able to provide insurance. So just be wary of people volunteering to provide services. If you're paying for that, it can get into a sticky situation. A couple other things to look for, just your gut. If you feel like things aren't working out right, if you feel like things aren't as they should be, you are well within your rights to go back to your agency and say, look, this isn't what we were expecting, and or we just don't like the way it feels and we want somebody else. You are paying for this service. There is no need to put yourself at risk when you feel like things are off. You're here taking care of your loved one, taking care of yourselves. You need to be on the lookout for things that might be a problem. For sure, having the background check makes a big difference. And you want to make sure you're not working with somebody who is less than what you deserve. I hope that's been helpful and explained a little bit of the different levels of care, from the in-home caregiver, the home health service, hospice service, and the in-home support services. They all sound so much the same. It's difficult sometimes to differentiate between these types of care. So I'll go.
Corey, if you could pause just a moment, I'm going to stop the recording.